smallpox, if you remember, used to be a very dangerous disease, but it was eradicated in 1980. So monkeypox virus is very closely related with that disease. And since this smallpox was eradicated, so was the vaccination for smallpox, which was also stopped. But over the last 40 years, more than 40 years, the human resistance to these kind of viruses have gone down. So monkeypox has it's raising its head. And WHO in July last year declared monkeypox as a disease of it's a disease of international concern. So monkeypox is a viral disease. It spreads from human to human, and although it's not as fast spread as that of COVID, because most of the listeners and spectators would have COVID-19 fresh in their minds, so they would like to compare monkeypox with COVID-19. So COVID-19 spreads through a human contact rather than droplets. So that's why its spread is much slower than COVID-19. The latest data is that there are about 87,000 patients, but the important thing is that it has been found in more than 110 countries. So this is why it is a disease of concern. So like smallpox, it has similar kind of symptomatology. It starts with flu-like symptoms. You have fever, you have headache, you have small blisters which appear on the palms of your hands and the soles of your feet and other parts of the body, including sexual organs and around them. So it is, again, like COVID-19, it is a self-limiting disease, which means that even if you don't do, 80 to 90% of the cases remain mild. But there is a 10 to 20% of cases which progress into a more severe disease, and there can be superimposed secondary infections, and it can be dangerous. So monkeypox, the signs and symptoms are it starts typically like a flu-like symptoms. You have fever, there's headache, but two distinct symptoms are small blisters which appear all over your body, but more pronouncedly on the palms of soles of your feet and body folds and around genitalia. The second very distinct symptom is that there are small, swollen lymph nodes, छोटी गिल्टियां हो जाती हैं, and these are around your neck and around your armpits and your inguinal region. So these are the signs and symptoms. The incubation period is like around about 2 weeks, after which when the blisters start appearing, then the blisters stay for about 2 to 4 weeks, and then they gradually dry up and you are free of disease. As such, there is no treatment, but symptomatic treatment is given. And as far the vaccination is concerned, yes, there is a vaccine available, but it is hard to find because the cases are so few. Pakistan, for example, after having these 2 cases diagnosed, has already requested the World Health Organization for vaccine supply. But unlike COVID-19, this vaccine is not given to everybody. It is only given to people who are immediate contacts of the patient. This does not spread very fast, so it's not that serious concern in terms of this becoming a mass disease, because you really have to touch the patient, or there is a body-to-body contact with the patient, only then you can contract this disease. And this is why the cases are not that much globally, although they are spread all over the world, 110 countries. But the other way of answering your question is that in countries like ours, where there are conditions so conducive for the spread of disease and people do not take enough precautions, and they touch the patient and they do not keep safe distance with them, and they do not have enough knowledge about the disease. So it can actually spread very fast also because of all these conditions. So what I would conclude by saying is that there is no need to become panicky about it, but at the same time, one should be careful and cautious about it. The government of Pakistan has already taken appropriate actions. There has been few emergency meetings at the National Command and Operations Center. The government has already released a advisory, which is available on their website, NCOC website or NIH website. And I think there has been an ongoing effort to screen the patients, incoming patients at the airports, which is very essential and very important. At the same time, I think what is needed is that the government of Pakistan should also educate people about the disease and its spread and what precautions people should take. There is this tendency, I have to say, to hide the disease and the data about the disease. If you even look closely into that, how we have come to know about these two patients, it is actually through media. Media investigated it, and they confirmed the existence of these two cases. Whereas what would have been more appropriate, that government itself should have announced that two patients have been identified, and this is what this disease is about, and this is what we are doing, and this is what people should be doing. So I think this attitude must change. We do not benefit ourselves, and we cannot stop the spread of the disease if we start hiding about the existence of the disease. The complete isolation with all the precautions, and as I said, that the disease is self-limiting in up to 90% of cases. So if proper isolation is done to ensure that the disease will not spread from the infected patient to others, I think it can be very well taken care of. So what people can do is that once they know that these are the signs and symptoms of monkeypox, and especially if they see these blisters appearing on the body of somebody, then they should immediately isolate that patient and take care of that, and ensure that people do not have body contact, or people do not touch things around that patient. So that's what people need to do. As far as the vaccine is concerned, yes, there are about 3 vaccines available for monkeypox, which provide reasonable level of protection. But since the disease is rare, cases are very few, so the vaccine is not readily available. So as I earlier mentioned, now government of Pakistan is trying to bring the vaccine with the help of WHO. And the idea would be not mass vaccination, but giving vaccines to the immediate contacts of the patient. Once the patient is found, you very carefully identify all the possible contacts of the patient and vaccinate them. So I think that's the best approach, public health approach, that can be taken in this regard.